Hello everyone and welcome again to Medical Insights. My name is Dr. Andy and today we continue like we promised you the last time that we would have a part 2. Today we are going to be talking about the physiological and anatomical changes of pregnancy, and there is none other than Dr. Cheryl Myler to help us unpack the topic. Dr. Cheryl, how are you?
Hi everyone, it's good to be back.
So just to recap, for those that might have missed our episode with Dr. Myler, we spoke about the whole journey of expectation and that it actually begins pre-conception, the importance of that first antenatal visit and the follow-up visits that your healthcare worker advises you, and the importance of the expecting mom and dad to be on this journey together. Dr. Cheryl made sure that we all understand that this is not a one-man's show, it's not a woman's journey, it's a together journey. Dr. Cheryl? So today we are speaking more about the physical changes, that occur during pregnancy. One is now pregnant, they're going for the ANC visits. But then suddenly, hey, the nose is big. Dokotela, why?
Okay, most of the things is because there's things that happen on your body in preparation of the baby, so that the baby is in a conducive environment to thrive while inside the woman's body. And also the woman's body, God made it to prepare itself for post-delivery, because as you're going to deliver that baby, the body anticipates that you may bleed. So before you even go into delivering, you start making lots of blood in your body that to prepare that should you bleed at delivery, at least you can compensate because you've made more blood before while you were still pregnant. So there's lots of things that happen in that sense. As well as to have more blood, not just for yourself, because now it's one body carrying two people. So everything that used to be for one now is for two. So that blood should be for two people, and also other things like the hormonal effects of the pregnancy itself. It comes with hormones.
The issue of the blood, don't children literally create their own ecosystems at the woman's?
They do, but remember, it's not just you still as a pregnant woman need to transfer nutrients to the baby, and that works through the placenta. What in my language they call it kubo ya ngwana. So there's that transfer of nutrients, transfer of this through that placenta. So you need more blood going into your womb to give to your baby those nutrients that is required by the baby to grow. So yes, you need more blood in that sense.
Okay. So, but that whole concept does it mean there are more blood vessels on the nose and therefore the full? Because it's just that interesting thing. Like you can literally tell even when a woman's like, I think she is expecting.
True, because they start swelling up. Yes. There is that thing. Your capillaries, you mean the end part of your vessels, start being more, they start to leak a bit, and then fluid move into the third space. It can happen overtly in cases like preeclampsia or hypertensive disease that is not good for you. Hypertension at all is not good, but it can also cause more damage to your body. In that sense, you swell up more. So it does happen in that the capillaries do leak a bit, and then you will swell up. And all these effects that come with pregnancy, it can take up to 6 weeks, which we call it the puerperian period. From the time you deliver, it takes 6 weeks until we say now you are out of it. So we have women coming a week later saying, but I'm still swollen. They just need to chill.
So swelling is actually one of the things they can expect to have as the changes that occur in their body.
And we see it mostly on the feet because that's what's carrying the weight of the body. So it does happen, you just elevate your feet, but there is instances where it can be pathological, meaning it's not good. It's not what we expect to be normal. Like in the cases where you have your hypertension diseases, you can swell up a lot, more than we expect. So if you are swelling If you're swollen up, then it's good to have it checked if it's now pathological or it's normal. Is something that you can expect in a pregnancy.
Yeah. So speaking of all of these physical changes and all of that, and I mean, I know we are children of God and we ought to have the spirit control the body, emotions included. But is it medically proven that when one is expecting perhaps to expect mood swings? Is it a thing? Should somebody expect it and therefore plan that, you know what, I'm not going to allow myself to be moody?
I wonder how you do that, how you plan.
It's just a matter of you being in control, being aware that, okay, I shouldn't snap, I shouldn't, because this is what is happening.
The truth is, yes, you do get hormonal, because remember the placenta being another organ, as I mentioned earlier on, it also secretes hormones. They now in more levels than they are when you are on your periods. You know, when you are during that menstrual cycle, you are said to be hormonal. You have the outbursts. They also happen in pregnancy, but we remember as children of God, right? In our anger, in our frustration.
Yes.
But it does happen, and we expect our partners to be more understanding during that period.
I think Dr. Cheryl should be the president of Women's.
I am an advocate for women.
And perhaps that explains why you are training to become an obstetrician. Now, there are other changes that women may experience. The hyperpigmentation, can they expect those to fade off as well?
They can, but there are those that stay with you for life. Like in my case, I never had pimples ever throughout my teenagehood, and I had my first baby, I started having pimples.
By the way, you are mother of two.
Yes, I am. So which makes it easy, because when you deal with women and you have been through what they are going through,
you're able to extend the sympathy.
Explain. Yes, you know,
yeah.
to
Which
empathize.
Also brings me to another question. In your working experience, do you tend to feel that expecting mothers either tend to have a preference on whether they want to be treated by a male or female OBGYN?
It also depends culturally and religious beliefs. We have some religious beliefs that they believe that men should not touch them. They will never, in my profession, it's quite intimate. Like it's going into your a very private space of a woman. So if there's anything the women regard as private is their own body. I don't know, men don't think that is so private, but with us, if we say our private space, we mean our body. So they do not want to undress in front of a male doctor, and you find those things happening that they will call you out saying,
please come and assist with this.
And sometimes you are the most senior at work and you are a male, and then now it has to be an intern examining that because an intern is a female. So it brings about those challenges, but it's not often.
And how is it always for you, when you treat your patients? How is the experience? Because majority, you are training to become an OBGYN, obstetrics and gynecology, but perhaps with the more focus on the pregnant women. How's the experience for you as a medical practitioner?
Most of the time it's exciting.
Yeah.
Like 95%.
Pregnant women are exciting, guys.
In my role, I just want to bring healthy babies and make mothers happy. That's all that I want to do. But there are those instances where you have to tell the mother that miscarriages, they break your heart. And in our line of profession, it doesn't allow you to sit with a woman for 2 hours and try to counsel them. It's rush. You see them, you diagnose it, you sympathize, and you want to be there more for them, but you don't have that luxury of time. So there are those things like miscarriages or bringing about a baby with congenital abnormalities. That really breaks your heart, because it's beyond your control. It's ultimately God decides who gets to live, who gets to die, and how the pregnancy goes. we try to help out where we can, but in those instances that is beyond you, then
and I can see you're getting a little bit emotional about it. I literally understand, because you are working with human life. It's natural to extend that sympathy. There's a scripture that say in the book of Matthew, where it says that as Jesus was passing by, when he saw the multitudes, he was moved with compassion. And I feel like compassion is that one important aspect of our profession. But going back to these signs that these women can expect to experience. Laziness.
Yeah.
Doctor says yeah.
Because this is the only time we can claim to be lazy. But honestly,
they are claiming.
Yeah, we are claiming. It depends on the pregnancy. Others say they carry heavy and it's making them sleepy all the time. And yes, progesterone can do that. There's effects that progesterone can make you sleepy. It can cause you to have vivid dreams, and it can also make you also the gastrointestinal where the motility, it reduces it, meaning that most pregnant women can have constipation and all of that. So it can slow you down a bit, but there's no reason to be lazy.
Thank you, doctor. Doctor's orders.
No, but they should allow us to be lazy, because this is the only time we can take advantage of this. It doesn't happen all the time that we can claim to be lazy.
I'm glad you gave it to us the way it is. And when it comes to sleeping patterns, can they expect changes in sleeping patterns?
They can sleep more. There's only a little bit, but those are those that have psychological problems, social problems, because women do face a lot of challenges in an instance where other households are not the same. You are now worried, you're now pregnant, you're worried, will I be able to provide for this child? Will I be able to give this child this and that? They end up not sleeping as they should, but basically pregnant women sleep a lot.
And it is highly recommended.
Yeah, it is highly recommended. It is good, actually, that
definitely.
They do, and not to take a toll on their bodies.
Yeah. Like I said, Dr. Cheryl, it's always so awesome to always have you here, but now we have to take a short break. When we come back, we learn how to prepare your bag for the hospital, what you need to put in there, and of course, when is the right time for you to take maternity leave? Stay tuned.
There is an unprecedented stirring of the waters, and the healing streams are flowing again.
It's flowing to every nation, every city, and every home.
There's anything that's been wrong in your life, especially your body, God's peace can get a hold of your system and bring an end to the sickness that you have been going through.
It's time for an unforgettable outpouring of the miraculous at the Healing Streams Live Healing Services with Pastor Chris this March, from Friday the 17th to Sunday the 19th of March 2023.
God sent me to you to bring you His healing. That's why I can utter words from Him. And it doesn't matter where you are in this great world. As I speak those words, the disease, the sickness, the infirmity has no option than to leave you.
This is your set time for a miracle. Register now at www.healingstreams.tv/LHS. For more details, call the number showing on your screen. The services will be broadcast live on www.healingstreams.tv and on the Healing School mobile app. The Healing Streams Live Healing Services with Pastor Chris. Your set time for your healing.
Welcome back, ladies and gentlemen, and thank you so much for having stayed tuned to Medical Insights. Today we are talking about pregnancy changes, the physical changes that one can anticipate. And like Dr. Myla highlighted, these are some of the changes that are actually expected to dissipate within 6 weeks post the time that you give birth. I enjoy the fact that you're actually also a mother. So now I want us to at least give an idea of what the woman can expect or what they need to pack into their bag. Pregnant women always have this bag.
And they end up losing them in the hospital. You see fights.
But is the bag actually necessary? Is it necessary?
It is.
Okay.
It is always necessary. We always anticipate that pack things for overnight. The first thing you pack is for the mom, which is your sleeper, something to be comfortable to sleep in. And you just expect, it shouldn't be, others go out to buy new things, but I would not advise that because it's going to have blood all over. Imagine your new things having blood, poop, and all that, because there's funny things that happen during labor and delivery time. So, you pack things that you're comfortable to sleep in with, your slippers, your shoes that should be comfortable, your bathing, toiletries and all that, that's for the mom. And an extra blanket if you can.
Yeah.
Because sometimes the weather changes unexpectedly.
And also if they're like well advanced into approaching their expected date of delivery, also packing the few stuff for the newborn.
For the newborn, yes. At least 2 sets of clothes that receive a blanket and extra nappies. Depending on where you're going to deliver, well, either private or private. Some places don't have nappies at all, so just have a pack of nappies, bum cream, all those things to bath the baby as well. So you don't need to bring your whole
wardrobe.
But just a few essentials that you sorted.
Yeah.
Yeah, but mostly it's bathing and dressing up things. Yeah.
Yeah. So now, Doctor, now that let's accelerate things a bit. Let's say we are now approaching the final weeks, all of those. What do you guys tell to women to expect as the signs of labor, as alerts that, I'm actually,
going into labor? Okay, it's contractions. Every woman has had a menstrual cycle and you know those menstrual pains. But this time, the menstrual pain are just not, they are now getting regular and more frequent and getting stronger. So it's your menstrual cycle pains which are now getting stronger, and when you check yourself down there, you can see a discharge that is mucoid or bloody. Then you know that now is probably time. And other unfortunate ones can have their water breaking before time. So it's all those signs that you can
signs,
yes. But there are also other signs besides that. That is when we check you out at the hospital to see the mouth of your baby.
Those are like for the doctor, but at least for the general public, those are the things to look at. Those strong, intensifying contractions.
Or just a rupture of your membranes.
Okay, and that is an alert sign to get to a healthcare facility. Now, just to go back a little bit, when is the most appropriate or the doctor's advice on when to take maternity leave? Say the woman perhaps is working, and even paternal leave. It's a thing in South Africa too.
I don't know what advice I have on that. Others, as you say, as the pregnancy progresses, we just get lazy and lazy and lazy. And people tend to take maternity leave quite early, like when they are still a month before they deliver, which I wouldn't advise. Because once the baby comes out, you want to spend as much time with your baby as you can. You'll end up leaving your baby home while it's still young and while your body has still not recovered well to go back to work. So most companies give 3 months to 4 months maternity leave. I'd say wait, work until you can't work anymore. And then that's when you can take your maternity leave. So I think maybe at 38, 39 weeks, that's when you can say, I am putting the tools down, let me go and prepare. But that's if your pregnancy is going well. But in some
obviously
when there are complications, it could be earlier.
Yeah. So now let's say that now the baby is born. For one reason or the other, the mothers may have to find themselves doing formula feeding. But let's talk about the benefits of breastfeeding. I know this is not like your hardcore specialty.
It is actually.
Is it?
Advocate for that.
Yeah. I thought it's more.
We do at booking visit actually.
Oh.
In antenatal period. That's another thing that we talk about to the moms.
Yeah.
RVD, HIV or not, we need to know how is this baby going to do. So there are certain things that we look into. There's what we call the EFAS criteria. Say you don't want to breastfeed, and I don't know why any woman rather not breastfeed, because it's actually safe, it's affordable. It's
readily prepared.
And it stays in fresh containers all
Yes.
the time. You don't need to wake up to go clean or sterilize any bottle.
Yeah.
So it's very convenient.
Yeah.
And you can even co-sleep with your baby while
It also
breastfeeding and
creates
all
that
the
time for bonding session. Yes,
You
yes.
know, so we always advocate for breastfeeding.
Yeah.
It's not just about the feeds, but you know, the breast milk also have immunoglobulin.
Yeah,
Which
yeah,
helps
yeah.
the immunity of
The
the
immune
baby
system
and,
of the
you know,
child.
Yes, and that bonding session that happens, which we wouldn't have with a bottle. So
Yeah.
We really advocate for breast milk.
They have ladies and gentlemen, the doctor's orders, they highly recommend that you breastfeed. But like I said, for one reason or the other, one may have to find themselves having to bottle feed, but naturally or according to what doctors prefer is that they advocate for natural breastfeeding. Now, just before we take a break, there's one thing I need to ask you. Naturally, we expect that the pregnancy is going well, everything is going well, person gives birth naturally. But for one reason or the other, let's say somebody gave birth through cesarean section the first time and they get pregnant again. What are the things they need to consider? Let's say now on their second pregnancy, they want to give birth naturally. What should they just think about? Briefly.
Yes.
Yeah.
If you've given birth by cesarean section, which is quite common, like everyone delivers by Caesar these days, the Caesar rate is quite high. It's alarming. Say you've given birth by cesarean section the first time. Secondly, we do not want you to fall pregnant as soon as we would want you to wait at least 2 years before you can fall pregnant again. That is to give your body time to heal, because that is a whole operation. So we don't look at the scar outside and say, you've healed. There's a lot going on inside that you, with your eyes, you can't see. So we'd advise the woman not to fall pregnant easy. And then there are certain things that we look into to see if this woman can deliver normal or not. The first being that the baby shouldn't be too big. If there is above a certain kg, when we do son and check the weight of the baby and we see that they are at a certain weight, then we can't allow you to deliver normal because it's risky for you. There's high risk that your womb might burst open.
Yes.
And then it has to be other issues like the placenta. Placenta mean your afterbirth. Is it sitting where it's not going to be in the way of the baby coming out? And we would want you to go into spontaneous labor, meaning that your natural contractions should come. And you should progress well throughout that labor to be able to deliver normally. So we do have a lot of cases actually which are successful.
Successful VBACs.
Patients,
That's quite.
Vaginal birth after cesarean
Yeah.
section.
That's awesome.
Yes,
Yeah.
depending on the center you are. Some hospital cannot offer it because these patients need to be closely monitored.
Yes.
You cannot just leave them unmonitored.
Yes.
So if you cannot monitor, then we don't allow them to VBAC. But if we can, we allow it. And in most instances, it's
Successful
successful,
rates.
yeah.
Interesting. And you know, one can tell that Dr. Cheryl is quite knowledgeable in her field. It's so awesome to listen to you. She's still learning. Well, she's in her second year of specializing into being an obstetric and gynecologist specialist. She's currently in her second year and it's a 4-year program. That was quite smileful, and thank you so much for that. We are going to take another break, and when we come, we are going to be concluding today's topic.
I want to ask everyone to pray for the healing stream coming up, because I really feel in my heart. Can I just share with you what I'm sensing about that, Pastor Chris?
Yes, sir.
There is going to be an avalanche of miracles. There's going to be an avalanche of miracles. So you're all to expect it. It's going to be like a wave of the miraculous in that. So I think everyone needs to start praying and fasting, and it's just coming up, isn't it, Pastor Jose?
March 17th.
March 17th through the 19th.
28.
You know, I just sensed it really strong. I wasn't planning on saying it. It's going to be an avalanche of miracles. Lord, can we lift our hands and praise Him for that? We praise your name for that, Lord. We thank you for what you're about to do during the days of Healing Street. Lord, I pray an avalanche of such power. Jesus. An avalanche of such power will flow. Healing rivers of fire will flow in Jesus' glorious name. Hallelujah.
It's time for an unforgettable outpouring of the miraculous at the Healing Streams live healing services with Pastor Chris this March, from Friday the 17th to Sunday the 19th of March 2023. Register now at www.healingstreams.tv/LHS. For more details, call the number showing on your screen. The services will be broadcast live on www.healingstreams.tv and on the Healing School mobile app. The Healing Streams live healing services with Pastor Chris. Your set time for your healing.
Welcome back, ladies and gentlemen. You are still tuned in to Medical Insights. Today we spoke about the changes that one can expect in pregnancy and, of course, how to pack your bag when you go to the hospital. And like we always do, we have a couple of tips for you from the Healing Nations to the magazine. And today they are talking about keeping your teeth healthy. And they mention a couple of things that you can avoid to ensure that your teeth are always in good health. It says here, avoid soda and juice packs. These contain large quantities of sugar and acid that gradually eat away your enamel. Your enamel is like the out covering of your teeth. Avoid sparkling water. Wow, I'm actually learning as well. Avoid sparkling water. It seems innocuous at first glance, but it is more acidic than lemon juice, for example, and can erode the tooth's enamel. And then here it also says that avoid all kinds of extremely cold drinks. Sharp temperature drops put stress on the enamel and can lead to cracks forming in your teeth. And I'm sure you do not want that. So those are the tips from the Healing to the Nations magazine. Remember that you can distribute this magazine in your working place or in your community, and on the 17th to the 19th of March, 3 p.m. GMT +1, we're going to be having healing streams with our men of God. Make sure that you register yourself and register anybody else that you know will benefit from this program. Please say the following confessions with us, and we'll be back shortly. And indeed, your body does not accommodate sickness. Today, we are still with Dr. Cheryl, who has been expatiating on us the journey of pregnancy and the things that we can expect, things that we need to think about and put into place, particularly as we prepare to welcome new life on earth. I think it's actually a miracle, that whole process of bringing life on earth.
Actually, when you work there, you just see the wonders of God.
Yeah.
Because how a baby can form and come out to be a whole human being, it's all a miracle.
Definitely. And just for the parents out there, I think we may not have all the time to discuss all of these things. Make sure that there are certain things that parents can look out for, like when the child is growing, their social interaction, the milestones, their motor, movements. So your child is expected to grow in a particular setting. They're supposed to sit at a particular stage. They're supposed to say mama and papa at a particular stage. So we may not have all the luxury of time to share all of those things, but I think we should have a pediatrician on board next time to help us with all of those things. Now, before we let you go, Dr. Cheryl, any words for our parents out there?
I think the first word is congratulations on your little one. And remember, once you're a parent for life. Yeah, we have those grannies that are 99 years having daughters that are 70s. They still are their child and responsible for them. So you are a parent for life for as long as you are alive. And yeah, God has given us enough grace to raise these people. So never doubt yourself. You are doing your very best, and yeah, keep strong, keep the faith. Kids do grow. It's not just a saying, it is true. They do grow. They just want your love, and that is mostly enough.
Absolutely amazing. And you can tell that that is not just coming from the cap or from the bosom of being a doctor. It's actually now coming from that aspect of her, which is a mother. Dr. Cheryl, thank you so much for coming through to Medical Insight. It's always a pleasure.
Thank you for having me.
It's always a pleasure to have you here. Ladies and gentlemen, that is all we have time for today. Make sure you catch our next episode, and remember the healing streams. Make sure that you use the link that is currently displaying on your screen to register people. Until our next episode, stay healthy.